Hot off the press, you can have it from us. I've got stage 1,
Okay.
bladder cancer of an aggressive type.
So this is the speculum going in, okay.
When I stopped drinking, I just detest it enormously. Yeah. I'm being honest, I cannot stop. It's as simple as that.
Let me just dip this sample.
Yeah.
Keeping it really simple, left hand. Yeah. As you find right hand is... it's mentally exhausting even just to do that.
That's all right, we'll find you on the system.
How can I help?
I've developed a rash.
Right.
Pretty much all over my body.
Right.
So this happened on Monday night, was the first time I noticed it.
Okay.
I'll let you look at it, but it looks a bit like chicken pox.
Okay.
But it's not chicken pox, I'm pretty sure, because I've had that.
Right.
But it's very much like...
So, let's just have a look. So, it's quite flat to the skin, but it's not itching.
Yeah, it's not itching.
And did it all just come up, or did you start with one spot?
No, it all came up.
It all just came up and it's not itching you at all?
The first time I spotted it was Monday night when I was going to bed. So I've been taking antihistamines for a couple of days.
That's not helped
It's
at
got neither
all.
worse nor better. It's
No.
just...
And also, so if it was allergy, you'd expect, A, it would improve with antihistamines, or B, it would be very itchy, but it's not itchy. Infection-wise, you don't have a fever, you feel well, you've not had a sore throat recently, or any infection like that at all. I might see if I can pick the brains of Dr Mackenzie next door, who's our skin guy. Do you mind if I just quickly see if he's around? I won't be a second. Can I just really quickly pick your brains?
Excuse me.
Right, so there's a gentleman here with this is Dr Mackenzie,
Hello.
with a 5-day history of a rash. Started on Monday. It's not been itchy in any way. It's not responded to any antihistamines at all. Are you not on any medications?
No.
No.
Didn't start as one batch.
I thought I asked that.
Came Monday night, took my clothes off to get ready for bed, and I was covered in it.
Right. You know, they're all
see.
sort of leaf-shaped.
Yeah.
One has to ask the question, no risky behaviours.
Absolutely not.
Good. There you go. Adults with a rash, you got to think of that.
Yeah. He's been well in himself. He hasn't had a fever, no preceding sore throat or anything like that.
I reckon that's pityriasis rosea.
Yeah.
That's a classic sort of sign there.
What, the scaling?
Yeah, the sort of scaling. I reckon that's what it is. So it normally take 10 to 12 weeks before it's sort of completely gone.
Okay.
You know, no creams will really make it better. Okay.
Brilliant, thank you. Okay, do you want me to print you off a little information leaflet?
Yeah,
about
that'd be helpful, yeah.
Yeah, the rash, there's a nice photo of it here. That's probably
It looks very similar.
quite similar, isn't it? Not contagious, so won't spread to other people.
And so just expect it to kind of disappear over the next number of weeks.
Yeah, 2 to 10 weeks, but can last as long as 5 months. But hopefully it will be sooner than that.
Don't plan to go on any beaches between them.
No, just cover it over.
I swallowed, do you know how many
put
tablets?
a note in your car?
13 a day.
Really?
And it's driving me potty.
Oh, that's a lot, isn't it? Yeah.
My cat licks me because it's salt and it makes his fur soft.
Oh, really?
He's a Persian.
I think once I go to just having to do the Wednesday one, it's fine.
It'll be all right. Come in. Hi. Charlotte, is that right? Hi, I'm Dr Rose.
Nice to meet you.
This is Laura. She's a healthcare assistant who gives us a hand. So
Time for the coil.
be looking forward to it.
Dreading it. Yeah. I know it hurts.
Because you've had it done before, haven't you?
Yeah.
You're keen to do the same thing again.
Yeah, although it hurts for the first, I found for 2 weeks afterwards, then for 5 years it's absolutely fine. So it seems like the best option of a lot of them.
So this is the coil that we're fitting. So this is what it sort of looks like. Basically what we do is I'll use a speculum, which is the thing that opens up your vagina so we can see your cervix. And then what I'll do is I'll remove the coil that's there at the moment. Okay. We have to go through the things that can go wrong. It's very unusual that anything does, but we just need to explain what can happen. No contraception is 100%. There's a tiny risk of pregnancy. If you were to get pregnant, then the pregnancy is more likely to be in the tubes rather than in the womb.
Someone told me their friend was born with, their friend's baby was born with a coil on their head.
Yeah, it does happen.
I've heard of
The worst thing that can happen to me as a doctor during a coil procedure is if somebody faints. This isn't uncommon because when we're fitting the coil, we stimulate a nerve, which makes it more likely for patients to faint. Because we can't see into the womb, there's a small risk of passing the coil through the wall of the womb. Sorry, I know this is the worst thing to tell people, isn't it? Just before we're doing it, but we sort of have to explain what the possibility. This
Have
is
you
never
done that before?
Never, never. So does that all make sense?
Yeah.
Yeah. You happy to sign your?
I am. My womb away.
Your womb away.
It's okay. Yeah. Hello. Registered baby?
Yeah, we just called. He should see a doctor. He's sick.
I've got it. All right. Go up to the 3rd floor if you want.
Nice to meet you. Ali Hassas, come on through. Grab a seat. Grab a seat. Right. How can I help?
Misha is now 11 days and totally healthy from day one, gained weight from day one on.
Great.
So, but this afternoon he started coughing and getting a bit weaker than he was usually.
Okay. How old is he? So he's 11 days old?
Yeah.
Okay. And is he breastfeeding or bottle feeding? And that's gone well?
Yes.
Feeding okay?
Yes. He never lost any weight even in the beginning.
And nappies, how are they?
He shits maybe 10 times a day, but he's gaining weight and he's healthy.
But the cough is what concerns you?
Yeah, and usually he's just totally boisterous and strong. And
quiet.
he's like,
should we have a look? Is that okay? Can you unpop him?
Yes.
And just roll just up. And can I come this side and you stay at the head ends? That'd be perfect. Okay.
We thought he has a slight temperature, nothing big, but
okay. Let me have a listen before he starts crying. This is not. Okay, buddy, let's have a listen. Oh. I know, I'm sorry. It's all cold and horrid, isn't he?
This mucus is like something related to a cold?
Just bear with me 1 second, let me just have a good listen.
Kate, isn't it? Have a seat, Kate. I'm Louise, one of the nurses. Rightio, you're here for your pill this morning.
I just need a repeat prescription for my pill, actually.
Okay. I just need a repeat for my pill.
Just looking to go back on the pill again.
Have you had thought about any other types of contraception?
I have. It's just, at the moment, I'm just carrying on this.
I did my test, pregnancy test, and it came that I'm pregnant. Because I was on mini pill, so, you know.
So you weren't planning on getting pregnant?
Not really.
No.
You all right?
Yeah. Come on, ladies, I can do this.
You'll be fine.
Come on, Mr. Coil.
You all right?
Yeah, sorry.
It's all right, no. It would be funny if you weren't.
Yeah, I know.
So this is the speculum going in, okay?
It's like a smear test, this bit, isn't it?
Yes, yeah. So it just feels a bit cold.
Yeah.
You're doing really well.
Okay.
Hey,
Sorry, do you mind if I hold you?
No, of course you can.
Are you all right?
Yeah.
You'll be fine.
You okay?
Yeah.
So we're going to take the coil out, okay?
Is it a nice big cough for me?
Cough. There
Okay.
we go.
Is it out?
Yeah,
Yep.
that's out. You all right?
Hurts quite a lot, sorry.
Okay. Is it easing off? It's not what it was like when you got that sharp?
It's still quite sharp, but it's not as bad. It's kind of coming in a wave now.
Yeah.
It's still there. Is that normal?
Yeah.
Yep.
So this is the coil going in now,
Okay.
okay?
You all right?
Is it in?
Yeah.
Yep.
You've done really well.
I
So you're.
I know I haven't.
You have. You've done amazingly.
I was practically crying. That's amazing.
I think it was the thought of it.
Hooray, 5 years.
Yeah.
You don't have to worry about it. Just
Thank
sit
you for
there
holding
for a
my hand.
moment. That's all right. That's what I'm here for.
Do you feel all right?
Yeah.
The whole going into the knife sort of thing.
Yeah.
I couldn't.
Like
do it.
people who want cosmetic surgery, like who are willing to put themselves like.
Just like, yeah, just needle me, just chop me open. I don't care. There's no point. It's like my boobs are good as they are.
It's exciting.
So he's a bit congested as well, isn't he?
Yeah.
When he's just breathing like this.
That has been for now 1.5 days.
Has it? Okay.
2 days, something.
Okay, young man. Let's get you up. Are you okay to give him cuddle him over your shoulder?
Yeah, of course.
And I'll just have a listen to his back as well while he's nice and settled. Just nice and settled. Just have a listen.
Haven't lost all your strength.
Is Mum at home?
Yeah.
Okay. Just pop him down for a second again. Oh, no. Oh, okay. Why don't you pop his things back on and then we'll have a chat. He certainly sounds congested when you do listen to him. But actually, when you listen to his lungs, his lungs sound clear.
Good.
So there's no sign at the moment of any infection on his lungs, and his heart rate is not much higher than it should be for his age. So I think sometimes when you have a lot of mucus at this age, because everything isn't as developed, it's difficult to clear it. Yeah. I think some of the things that might help with that is that, so generally steamy environments, I think would be useful. Some moisture in the air.
We have a thing like that we put in
around the bedroom. Perfect, that will be useful. And you can get, I mean, they're very little at the moment for saline sprays, but you can get sprays for the nose that helps from the pharmacy that helps clear some of when it's very sticky.
They have that down here?
Yeah, downstairs we'll have that. So let's try the humidity. Let's see how this settles in the next few days. You need to keep a close eye because of his age. They can suddenly change, as you know. So if you find that actually you're struggling with feeding, the nappies are not as wet as they were, or he's still not as alert, or things are not improving, or if you look at his chest and you see that his ribs, he's pulling in his ribs, or at the base of the throat, he's pulling it in when he's breathing, that's a sign that he's working too hard with his breathing. And that's a sign that you should get somebody to see him, even if it's in the middle of the night.
Thank you very much.
Not at all. You're right to get him seen, yeah.
Thank you so much.
No problem, he's nice and alert now. Okay. All right,
Bye-bye.
Take care now. Bye-bye.
He's had a viral infection. He was never that ill, but it tickled up his airways.
Hello. Who's this? Oh, hello.
Are you ready? Oh, good girl.
So you noticed those spots first yesterday as it came on today?
Yeah, and they seem brighter.
Sometimes with skin rashes, it could be due to an allergy. Has anything changed at home? Any pets? No? Or any... Can't smell it yet. Can't smell it yet.
Meningitis is basically bleeding under the skin. So when you wipe a finger over it or put a glass on it, it doesn't disappear. Don't worry about any of that, okay?
Hi, how you doing? You all right?
I'm seeing number 8. I'm
Sorry.
I feel terrible. I've got deaf in one ear for start,
Okay.
which I don't know why.
I'm getting a noise there all the time, and I can't hear a damn thing. It's driving me bonkers.
One thing that I was quite keen to do, remember last time you had that cyst?
Oh yeah, got that.
I wanted to have a wee look at that. If that's
well, the antibiotics seem to have worked, and it's got like a crust on now.
Yeah, I think we'll have to see what becomes of that, really. That infection has settled down, and that there's no real mole there anymore or anything.
If it was a mole, I must have caught it or something like that.
Well, should we just see how it goes? We'll keep an eye.
I'll keep it. Well, I mean,
keep an eye. We're going to be meeting anyway, aren't we? So we can just periodically review it. Okay.
Yeah, sure.
What else would you like to talk about today? Obviously, there's a lot going on, but
I would like to get a consultation with a drink specialist to get me off the booze because I am seriously concerned.
Yeah.
Because I'm getting home now. I'm depressed.
Yeah.
I'm not suicidal. Don't get me wrong, but I just start drinking, and I can't actually just say I'll have 2 and stop.
Yeah.
Once I've had 2, that's it. Boom. I don't know what the answer is, I really don't. I know it's not doing me heart any good at all.
Yeah. It generally doesn't do you good to drink lots and lots.
Especially, I mean, I do appreciate it, but I've got no willpower. I try and try and try. It's very, very hard,
Yeah.
But I do want to stop drinking. I just detest it enormously.
Yeah. Dropped a line to that alcohol liaison.
You haven't heard from them yet?
I was hoping you might have heard from them.
Not a sausage, nothing. I'm being honest, I cannot stop. It's as simple as that.
Yeah. Okay. Alcohol services, I'm going to write to them.
Okay.
Do you want me to give you their number as well so that you can
You could do, if you wouldn't mind. Yeah.
So I'll find that for you in a sec. Okay.
Okay.
Do you want to catch up with me, in a couple of weeks?
Should I make an appointment or should I just give you a ring?
Talk on the phone if you want next time, save you a trip down.
Okay.
Yeah, and then we can see if there's anything that you feel you need to go see, and I can stick you in for an appointment.
Fine.
All right.
Thanks very much.
No worries. Take care. All right.
I'll see what I can do.
Yeah. All right. Look after yourself. All right. Cheers. I referred him to Drug and Alcohol Services quite some time ago now, and he was transferred to your team because he fell out of area, full stop. He's really desperate to cut down his drinking, and I would appreciate any support you could provide as soon as possible, full stop. Thank you for taking the time to see him, full stop.
Three people queuing and just me, Carol, and you picking up. Good afternoon.
It's okay, it's one each.
How can I help?
Putney Me, good morning, Nicola speaking.
Susan Watts, please. Thank you. Come through. So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes so the worst they'd ever be? So I think it's a hereditary pattern.
Yes, it can
rather
be.
than it being dementia or anything. And I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So I, probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case I'm pretending it's not Parkinson's, but then I read the paper today saying everybody's encouraged to go to their doctors and doctors get £50 rent. Oh, God, I've got... Yeah, it's in the Times.
£55?
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination tests. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Yeah, close a bit.
I mentioned that
How do I get back to mine?
the car was stuck in.
I'll get on to it tomorrow. So basically, here's how you take the payment.
In M&S, and he said, yeah, he said there was one yesterday as well.
And then you do that with sync.
He's in 9, he's in a different room now.
Oh, is he? No, we were in 9 yesterday.
We weren't in 12, wasn't yesterday.
Nice to see you. Come on in.
Likewise. Do you live anywhere near Kingston?
Do I live anywhere near Kingston? No, why is that?
Oh, in 2 days, 2 people have jumped off the roof of M&S. In 2 different
right?
parts of the store, and our car is trapped there now until tomorrow.
Because you couldn't leave because someone...
Because they jumped off the car park.
Is that
today.
right?
Yes.
Gosh, that's very
Well,
sad,
that's
isn't
nice.
it? How are you doing?
I'm fine. I'm fine. The blood part of the urine disappeared after 1 tablet.
Did it?
Yes.
Okay.
I still took all 6.
Great. So no more bleeding in the urine?
No.
Any more clots?
No.
Nothing like that?
No.
You were going to see the urologist,
Yes.
is that right? Have
So
you seen the urologist?
Yes, so did you want to see us today to report
How
to
things
you
gone?
how it
yeah.
all went? Certainly. They reckon they'll get something to you within 48 hours.
Okay.
But hot off the press, you can have it from us.
What did they say today?
I've got stage 1
Okay.
bladder cancer of an aggressive type.
So I've had blood in my urine since like May, let's call it, April, May.
As soon as my urine starts to go funky colours, I come in.
Brilliant. Thank you.
Is it normal for the urine sometimes to smell a little bit sort of putrid?
Well, that suggests infection, really.
Yeah.
Let me just dip this sample.
Yeah.
Oh. That wasn't very clever, but I've still got some.
When they biopsied all the crap they'd taken out, they found that the cells were would have been of an aggressive nature.
Right.
No evidence of it in the muscle wall.
Great.
And that's it, really. I'm very lucky, primarily because of you insisting on these constant samples and then taking it that bit further.
When you do pick up a cancer, it's very rewarding because it can have a big impact. It has a huge impact on people's lives. And most bladder cancers, thankfully, are picked up very early, before they've had a chance to spread into the lining of the bladder. And therefore, the prognosis for most bladder cancers, thankfully, is very good.
And how are you feeling about all of this? I mean, it's all kind of new stuff, isn't it?
Wonderful. It's whatever it takes.
Whatever it takes, yeah.
Whatever, and I don't feel at all bad. I feel absolutely wonderful that I've got it, because I know I've got it.
In fact, you know you can do something about it.
Yeah, right.
And nothing else is involved. And I think
No.
that's the important
She
bit.
did
of this.
mention the surgeon, who's a lovely lady, that bladder cancer rarely extends beyond the bladder.
This gentleman is an incredibly positive and determined gentleman. But in a consultation, I think I'm doing 2 things in my mind. One being present in the room and listening to what's being said, but also being curious about what I'm not hearing from someone who's dealing with cancer, and why I might not be hearing that. And that's as important for me.
Okay, good. So you're feeling positive about it?
I don't think I've ever felt particularly negative.
No.
You've not noticed, have you?
No.
Have you?
Well, a couple of times you've been a bit wobbly.
Well, when I made a reservation at Dignitas, I suppose you could call that slightly negative. But they said they didn't have any vacancies that Tuesday.
Will you do it? Will you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good.
Oh.
Good. I want you to try and do that as quickly as you can. Quick, 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 quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? done. Good effort. Okay, so if you could just write that underneath, that would be great. Thank you.
Far slower than I used to write.
Really? Yeah. Yeah. And this arm was tremoring as well.
Oh, was it?
It was when your hand.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is, being such a capable lady, to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
right.
You would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank you.
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
It makes it a more enjoyable job.
For some reason, I'm covered in a burning rash.
Right, well, you're a little bit of a mystery.
I have a hot shower and it goes away.
It's weird, isn't it?
Lost 2.5 kilos in 4 days.
Yeah, that's a mystery.
I keep getting these blood blisters. I mean, these are puzzling, I must say.
Sometimes in medicine we can't say what specifically something is, but I can tell you what it isn't.
What can I do for you?
I have a mobility issue in my right hand.
Okay.
I'm an office worker. Typing is becoming incredibly difficult, really quite painful. It's kind of something which has evolved over the last 6 months. Keeping it really simple, left hand.
Yeah.
That's it fine. Right hand is just have very limited mobility in it.
Okay. And what's the origin of that?
I don't know.
Okay.
I'm typically male, typically late about coming to doctors, all of those things.
Are you left or right-handed?
Left-handed for writing, but like right-handed for sport.
Okay.
The thing I'm wondering is I've learned golf this year. Don't know.
You have enough dexterity to do that, so to grip the club, but
I just noticed pain
typing.
Occasionally.
Do buttons up and stuff?
Doing my cuff is a lot harder.
Yeah.
But I can do it.
Have you noticed it with anything else? Tying your shoelaces?
No, shoelaces is fine.
Would you mind just tying your shoelaces for me? Or untying
It won't be a problem at all.
I'm just looking at you using that right hand, because that command, from your brain seemed to be automatic and seemed to work fine, didn't it? Do this again, so like you're playing a piano. Do you play the piano by any chance?
I used to a little bit when I was younger, but the left hand's 100%.
Yeah.
I could do that all day long.
And you can't do that at all with that hand?
So I'm commanding my hand. It's very tiring. I'm going, come on hand, come on hand. It's mentally exhausting even just to do that.
Yeah.
I'm really saying, come on.
Yeah. So for example, do this. So the elbow, shoulder, you can swing around.
I mean, I've got 2 kids, I can load up
So
weight.
it's just the fingers, literally.
It feels
what
the
about,
fingers and the wrist.
So do your wrists for me. And round and round. Round with that one.
I'm trying.
So wrist and hand. If I touch your hands, does that feel the same?
Doesn't feel any, without being extreme, doesn't feel like I've had a stroke or paralysis,
No.
anything like that at all.
And so the sensation to you feels the same. You're not no pins and needles, nothing like that.
No, never at all. Or else I would have come. Absolutely would have.
And just you can't.
I can command it, but I just can't translate it.
I think it's quite common in general practice for a patient to come and to have something that it's very hard to put a name on and to diagnose as something. I think whilst medicine is partly scientific, there's also a lot of art to it as well, if you like, and it's some of what we do is almost trial and error.
What I am going to do is ask for advice. We've got a kind of email advice line. What we need to do is get some sort of imaging or study on that. We can do a nerve conduction, and I just want to check if that's the right thing to do or if it's some other sort of test. So what I'll do is I'll get some advice and then I'll let you know. So I basically I don't want to send you down the wrong route.
Yeah, no, it's tough.
But you've absolutely done right in coming to see us, and we need to look into it and find out what's going on.
Patients seem to appreciate it if you admit to your, lack of supreme knowledge almost and say, I actually don't know what's going on here. We're human at the end of the day, and we don't know everything, and as long as we're honest about that and admit that, I think they, on the whole, don't seem to have a problem with it, and I don't either, really, I don't think.
I shall get back to you in either tomorrow or Monday.
Cool.
Is that all right?
That's lovely. Really appreciate your time.
Fabulous.
Thank
Okay.
you very much.
No,
Take
good
care.
to see you. All right. Bye.
So I can do that.
Yeah, I was about to say. It's a good, strong handshake, so. All right. Bye.
I've got 40 tasks. 40.
I've got none.
All right, rub it in, why don't you? 40 tasks.
I haven't. I've got none from today.
I've got one. Good. One. It's because I don't delete them. That's how bad I am.
I actually asked the patient to come in for it.
Come in.
Good afternoon.
Hello, hi. Is that Alexander? Is that right?
Yeah. Basically, about a week ago or so, completely out of the blue, in the middle of the night, I woke up to a really bad chest pain, right down the centre bone.
Right.
Nothing else really associated with it. No difficulty breathing. Nothing that was going to cause me concern or think I should rush into hospital. So I put some deep heat on it, and then since then the pain's just been fluctuating. I get a heartburny kind of sensation as well quite a lot of the time.
Is that before the pain came on?
During the pain, actually, to be honest.
Okay.
And so it comes in waves, and today and yesterday it's kind of become a little bit more consistent or continuous, I should say.
Right.
Because it's making me feel a little bit groggy as well, to be honest. And
Yeah. And what had you been doing that day or the day before? Can you remember?
I've been going to the gym, and I have been going to the gym probably with more intensity or regularity than I would normally in the last couple of months. I've certainly stepped it up a bit.
Have you been feeling short of breath at any point at all?
It's not so much a shortness of breath as it feels like quite a laboured breathing.
Would it be okay if I had a look?
Yeah,
That's
absolutely,
okay.
of course it is, yeah.
And what do you do work-wise, if you don't mind me asking?
I'm an airline pilot.
An airline pilot?
Yes.
Oh, okay. And have you been on any long-haul flights or anything like that?
Yeah, I mean, I've been flying fair distances, but nothing outrageously far.
So in the last week, or?
Oh yeah, I've been flying.
Oh, okay.
I've been flying most of the week, in fairness.
Is it affecting work?
It's not affecting my work. It's just one of those things that it fluctuates, but it never affects my levels of concentration and whatever.
Fair enough. It's just the kind of niggly thing that's there and comes on and
goes,
lingers a bit. So if I push on it,
Yeah.
can you just tell me if it hurts you at all?
Yeah, that's tender.
That's tender. That
Yeah.
caught you. Sorry, I don't mean
It's
to
all right,
make you
that's
jump
fine.
off the bed. What about on the other
actual
side?
Chest itself, no,
Yeah,
it's not
chest
too
wall
bad.
itself.
It's not too bad there.
I'll let you put your
Yeah.
shirt on. Do you mind just putting your t-shirt on, not the jumper? Just going to do your blood pressure, and then I'll go through what I think is going on. If it'll make a bit more sense.
No, it's fine. I'll try and relax the arm.
Yeah, absolutely. Relax as much as you can. Okay. The upper value's ever so slightly on the higher side.
Okay.
It might be because I've been pushing on your chest and caused you a bit of pain.
Yeah, maybe,
just
I don't
now.
know.
Doesn't strike me as a heart problem in any way.
Okay.
Because heart problems tends to feel a bit different, more of a kind of tightness, pressure sensation
Yeah,
that's
it's
worse when
certainly
you're
not
doing
that.
things. And I think you've got an inflammation of the bone here.
Okay.
But the fact that when you push on it, it's quite tender. It suggests there's something quite local around that area.
Okay.
I think this is almost certainly because of the gym work. The treatment for it is anti-inflammatory medications. So I don't know if you're okay.
Ibuprofens, maybe?
Yeah, exactly. Ibuprofen, okay.
No, thank you for your help.
And I think flying's okay.
Good. If you think it's okay.
No, I think it's okay.
Funnily
In
enough,
case there was any
I've got
doubt.
days off now, actually,
Fair
so I'm not in for a while. So I'll give it a rest now for a few days, and fingers crossed it'll work.
Hi there.
Is Dr. King on the third floor?
Yes, he is. He's on the third floor. I was just about to get there. Is your name Brian?
Yeah.
Yeah, I'll sign you in.
Thank you.
What I've come in for today is, can you imagine, can you guess?
Stitches?
Take stitches out, yeah.
I think you might have a boil or an abscess there in your neck.
Let's take this one out and we'll see what happens.
That's hurting.
Sorry.
This piece of nail,
Yep.
it smells bad.
Oh, yes, there's not much of a nail left.
No.
Take some deep breaths. All this is swollen, isn't it? The red thing around is still there.
I'm not sure what that is, and I was wondering if you can diagnose it.
I think it's a fungal infection from the way it is.
Right.
Hi.
Morning.
Is it Margaret?
Margaret Yakutiel.
Yakutiel, yeah. I'm Dr Baveja. Nice to meet you. Oh, is that just your...
Listen, I think I've got scabies. I get these frightful attacks of scratching. I mean, it began here and I managed to stop.
Yeah.
I get them on my hands. This was last week, there's the signs.
Right.
I'm also a doctor, epidemiologist. And it
Right.
just looks to me like scabies. And I bought some stuff, actually. And then somebody told me there's a better stuff called ivermectin, which you can take as a pill. Can I show you a place on my...
Yeah, please do, please do.
Okay. I just want to show you where... Sorry.
Yeah, of course.
This was one about 3 or 4 days ago.
Yeah,
I scratched. I just couldn't think of anything else it could be. I've had it here.
Right.
There's not much old.
Is there anything else to see?
No.
No, okay. You've had an itchy rash that comes and goes.
Yes.
I've got no information on you. Are you normally fit and well?
Well, I've got cancer of the lung.
Right.
That's been done by stereotopic body radiation,
Yeah.
SBRT, about half a year ago. And I had a myocardial infarction 7 years ago.
Okay.
My blood pressure's low, not high. Otherwise, I'm well.
Do you take any regular medication?
I've got some arthritis in my hip, so I take diacerin or something.
Doctors sometimes can be incredibly resilient and feel that because they have some, a lot of medical knowledge and experience, that they just deal with their symptoms. They might try and soldier on.
Where are you normally registered?
Israel.
Okay.
I'm here visiting my sister.
Okay, and you're an epidemiologist? What, like a doctor, like a public health?
Yes.
Okay, all right. And how are things in Israel, all right?
Ghastly. I may have picked it up in Israel. God knows, after this war, all the soldiers coming back. But I don't know. I mean, I didn't have anything there.
Difficult one. It doesn't look like classical scabies, but as you know, scabies is the thing that mimics many forms. I haven't heard of the tablet that you mentioned.
Well, I'll tell you how to spell it.
Ivermectin is not recommended.
Really?
Yeah.
Has it got contraindications?
It's on a named person basis only available and has been used in combination with topical treatments. So I think perhaps you're better just using the permethrin.
Which is the antihistamine one?
Cetirizine.
Cetirizine.
All right.
The tablets.
Yeah.
That's for the whole body. You don't have an ointment instead. I mean, I don't need to take something when I've just got an itch on my hand.
It'd be better with that, probably.
Yeah?
Yeah.
I have in the past treated doctors who have felt that we should be doing one thing for them, and I felt that we should be going down another line.
It's like taking things more. I mean, I have to, but
Yeah, try it. It's tolerated pretty well by people.
Okay.
All right, take care. Bye now.
Why do doctors go to the doctor?
That's true. If you're a doctor and your friends are doctors, they could just prescribe anything for you.
Give you drugs.
Yeah.
Sorry, it's not ideal for you, is it? What can we do for you?
I'm going to see my family in South Africa next week.
Okay.
Which is quite traumatic as it is. But I'm going to run out of pregabalin whilst I'm there, and I just wondered whether I could get some more pre.
Is pain a significant problem then? Have we been sort of playing with things to try and get it manageable, or is it manageable at the moment?
It's not manageable because it's there all the time. So I guess we have in a sort of intensive period of trying to get this tilt assessed more. And then also try to take me off some of my morphine because I'm quite heavily addicted to it.
Okay. Perhaps not the time to start changing things now, anyway. But I wonder whether have you flown before taking these medications with you?
Yeah.
Sometimes people like a letter for those sorts of medications, which I'd be happy to. But you've never run into problems.
Yeah, I've got a prescription.
Yeah.
Thank you very much.
Anything else we can do for you?
Thank you.
Okay. There you go, free. Cheerio.
How are you doing?
Yeah, the tablets are a lot better now. Thank God.
Great. Are they?
Really, really well, yeah.
Mummy, come here.
And I'm actually waking up in the mornings feeling like I've had a sleep.
Great.
I'm so happy with it. I'm so happy, yeah, I feel a lot better.
When are you going?
I'm going to Ireland in 3 weeks and then we're going the week after. So, yeah.
And where are you going to be staying?
My sister's.
No, in New York.
Oh, New York. Oh, sorry. We're actually staying in a hotel just off Central Park.
It's a beautiful time as well.
It's lovely. I love it. Yeah. I love it. Yeah. And it's not. I don't like going away.
Do you feel frightened to go
I'm a little bit nervous because I am worrying, is something going to happen to tumour up in the air, you know?
There is a risk flying. It's different for every patient and at every stage of the illness, and actually for where in the brain the tumour is. It's to do with the pressure of the oxygen in the cabin.
The thing about it is I could be here, I could be walking down the road and something had happened, so it's one of them things, you know what I mean?
Before you go, I think I'd quite like to give you a letter as well to take with you, give a medical history just in case.
Please God, but if anything happens.
Yeah, I think what was going through my mind through the consultation was I can't make Fidelma better. But I think it was just so important a trip for her to make. It was very symbolic. She'd been given this as a 50th birthday present at the beginning of the year when she was totally ignorant that there was a brain tumour growing. Oh, I'm so pleased you're going.
Yeah, no,
I'm
really
so
pleased. No, they've all been given out to me. My mum, she's gone.
Of course they would.
Go.
Of course they would.
Do you want to give Dr. Ham a high five?
Wow, that's stinging.
Come here, you've been so.
Have a good time.
You've been so good to me, so you have. Really, really good.
Have a good time.
Yeah, I will. And you
have a good time.
I'll see you. And if there's anything you want, let me know.
Yep.
I did tell you that.
You did tell me that. You did tell me that. Right, lovely to see you. Thank you. All right, bye. Bye. Oh, she's a nice lady.